Good afternoon. This is Gamal Craig Nuchtai here to provide you with an update on the COVID-19 situation in our community as of August 27, 2020. On August 20th, we were made aware of a single positive confirmed COVID-19 test result of an individual who lives in the community. This individual is still currently self-isolating as per the standard 14-day isolation protocol, as well as the other individuals who have been identified as direct contacts with the known case. These individuals were identified during the contact tracing process, which was completed on August 21st. Please note that we have strict obligations with respect to protecting sensitive and confidential information pertaining to specific cases. If you have any concern or questions about this process, please contact Marina McComber, Community Health Nurse at 705-507-0134. Our COVID-19 response team has met frequently to assess the situation and provide recommendations to Council, including the reopening of the administration office buildings, community center, reserve camp, and chalet, until as we have determined that we have contained the situation and there is a very low risk of any spreading of the virus in the community. We will be updating our reopening plan to incorporate lessons learned from the most recent case and to ensure it is clear how we will respond to these situations moving forward. Please be advised that band-owned facilities will reopen on August 31st, 2020. Please be advised that the state of emergency has been extended by Gamal Council until September 29th, 2020. This provides an opportunity to not only convey the significance of the ongoing pandemic, but allow for Council to pass emergency measures to either close or open the community through a phased approach. There are orders and precautions currently in place to protect our community and visitors. These orders and precautions include maintain 6 feet of physical distancing from any person that is not in your designated 10-person social circle or household, and wearing a mask if this is not possible. Wash your hands frequently with soap and water or hand sanitizer. Stay home if you are feeling unwell, and stay home unless you are leaving for essential services and errands. Monitor yourself for signs and symptoms of COVID-19. You can see these on the Public Health Sudbury and District's website for a list of symptoms. Avoid any non-essential travel and self-isolate for 14 days or get tested when returning to the Sudbury area from out of province or high-risk locations, as noted in the Gamal Council orders posted on our website. If you have any questions with regard to the testing, please call Marina McComber, Community Health Nurse at 705-507-0134, or Carmen Wabagija-Nuchtai, Director of Health and Community Wellness at 705-822-3462. You can also email us at covid@wlfn.com. That's COVID@wlfn.com. So that's the update, and thanks again, and we'll see you soon. Pamapi.
Miigwech for that, Gima Nichtai, and thank you for that update. I'm sure the community is appreciative of that as well. So we are going to continue on with our health Q&A. Today is Thursday, August 27th. We do have a panel of individuals on our on the show today, and I will let them introduce themselves before we begin. So I'm Carmen Wabagija-Nuchtai, Director of Health and Community Wellness for Atikamekshenganishnawbek, and we'll move to Lisa, then Rachel, then Amanda and Marina.
Good afternoon. I am Lisa Grew. I'm the Home Care Manager in Atikamekshengashnawbek.
Oh, Rachel, I think you might be on mute. Okay, I think we're experiencing some difficulties. Bridget, do you have Rachel on mute?
No, she's not on mute, so I'm not sure what's going on there.
Okay, it might be your sound on your system, Rachel. So we'll move on to Amanda, if you want to introduce yourself.
Hi, my name is Amanda Jordan. I am the Health Promotions Manager.
Thank you. Marina?
Hi, Hi, everyone. My name is Marina McCumber, and I'm the community health nurse in atikamekshenganishnawbek.
Hey, okay. Rachel, were we able to figure out the technical difficulties? Okay, no, we can't hear you. Okay, so Rachel Pattison is our health programs manager. She just joined our team a few months back, and we're glad to have her aboard. And hopefully she can fix her her sound issues. But we will begin. And just want to start off again with some statistics. So in atikamekshenganishnawbek, we do have one confirmed case, 0 result. I just want to give a little bit of a brief explanation to the resolved. Resolved cases meaning they have to, once they're out of their self-isolation of the 14 days, then it would be a resolved case. Okay, so that will come up in the next week. By public health, Sudbury and districts, we have 94 confirmed cases. This was, and as of August 25th at 5 p.m., there were 29,639 tests performed. They do have, as of August 22nd, 94 cases, 93 have been resolved. As for the Ontario government, as of August 26th at 10 a.m., there are 41,813 confirmed cases, and of those, 37,940 have been resolved. Has Rachel been able to?
Hi, everyone. Can you hear me?
Yes.
There we go. There we go. Okay, so I had switched over laptops, so I apologize. So this week we want to also start with responses to the community's questions that were submitted. This will be followed by a quick description of the process that is completed if and when we receive a confirmation of a COVID-19 case in the community. We will then update everyone with the criteria that we have developed in deciding how we will move through stages 1 to 3. In a similar way that the province has. To complete our session, we will then present reminders about how to plan and attend gatherings safely throughout the pandemic, during the pandemic, and conclude with defining some commonly used terms used during the pandemic. So one of the questions that was posed was, what's the difference between, what is positive with symptoms versus what is positive with no symptoms? Common symptoms of the virus include new or worsening cough, fever with a temperature of 38.7 or above, or chills, and difficulty breathing. With other symptoms also include sore throat, loss of sense of smell or taste, difficulty swallowing, a runny nose, or nasal congestions without any underlying cause, such as allergies, any nausea or vomiting, diarrhea, and abdomen cramping. There is also a possibility that a person with the virus does not show any of these signs or symptoms, and if this is the case, they would be considered asymptomatic, but they are still at risk for spreading the virus. The only way for someone to know if they have COVID-19 is to be tested. This is why you will see a lot of people getting tested, even though they do not show any symptoms.
Okay. I'm going to talk about what happens if we have a positive confirmed case in atikamekshen. Currently, the process is I'm advised of the positive case in the community by a member or through the CD unit at Indigenous Services Canada. And then I receive direction from inform when I'm told when to start contact tracing and on the handling of the case by Indigenous Services Canada and Public Health. Then I begin contact tracing and determine who is an identified close contact and the time frame for recent contacts. All identified close contacts are notified and provided instruction. They're asked to go for a COVID test, and they're asked to isolate for 14 days from their last exposure. An identified close contact is defined as someone who has been in contact with a confirmed COVID-19 case within 6 feet without a mask for over 15 minutes. Those who have been identified as close contacts will be required to self-isolate and will not be seen throughout the community, for example, in workplaces or visiting friends. Please be advised that all information is confidential. No names are shared with anyone besides the CHN and the Director of Health.
Can you hear me?
Now we can. It's a little
Okay. I was muted. Sorry. So good afternoon. I'm going to talk about what is the criteria for stage progression. This was added to the reopening plan to identify the criteria we will use to recommend either tightening the restrictions or loosening them. So stage 1 is protect and support. Re-implementation of border with defined guidelines for all retailers. Please see stages 1, 2, and 3, closure of non-essential workplaces and outdoor parks, gatherings, and limited access to the community by band members living off reserve. Provide essential services, re-implementation of strict guidelines with all retailers, curbside pickup for members only. Criteria: significant increase in COVID-19 cases at regional, 2 or more confirmed cases reported daily for 7 consecutive days, and provincial levels, over 250 new confirmed cases daily.
Okay, and I'm going to continue with stage 2. So reopening of non-essential workplaces with safety measures implemented, outdoor amenities, parks open for public use, gathering limits are increased at this point, and criteria is a significant decline in COVID-19 cases at regional levels, less than one number of confirmed cases reported daily for 7 consecutive days with no indication of community spread, and also provincial levels under 250 new confirmed cases daily. And for stage 3, transitioning to a new normal, criteria: no regional cases or evidence of community spread of COVID-19 for 4 weeks, and vaccine becomes widely available. Our criteria has been based on trends and surveillance data collected by Public Health Ontario and is subject to change.
Mhm. So I just wanted to mention to everybody that this stage progression is something that we added to the amended reopening the community plan. And I just want to reiterate though that although this section is in the plan hasn't been updated or approved by Chief and Council or Gimon Council yet. It will go up to the September 8th band meeting. However, this is what we've recommended to be put into the plan to help us as we determine when to either loosen or put in further restrictions. So I just want to make sure we announce that. So we can continue, Amanda?
Okay, so we would also like to remind community members about how to practice physical distancing in any setting. So avoid any form of physical contact, such as a handshake. Maintain a 2-meter distance from anyone that is not part of your social circle. And if that's not possible, wear a mask. If you're unable to practice the guidelines that reduce the spread of the virus, it is recommended that the event or be postponed or canceled.
I also want to just interject here. Sorry for all the interjecting here. But with this piece as well, when physical contact, we also want to make it known to everybody that even just sharing a cigarette or a drink is sharing saliva and passing that on. And in that sense, we could pass on the virus. So at this time, you know, it's really recommended, don't share your cigarettes, don't share your drinks, don't share basically anything. I believe Lisa's on right now.
Hi. We will now define a few common terms associated with COVID-19. Asymptomatic means a person that is showing no symptoms of the virus. An identified close contact is a contact to a positive COVID-19 case that has spent more than 15 minutes closer than 6 feet distance without wearing a mask. Contained means that a case that has been linked to travel or a close contact with an individual confirmed to have the virus. Community spread means when a person contracts the virus but has no travel history or close contact with a confirmed case. It is suspected that there may have been indirect contact somewhere in the community. Incubation period of COVID-19 is estimated between 1 and 14 days, with median estimates of 5 to 6 days between infection and onset of symptoms.
Okay, thanks for that, please. Okay, so I think it was really important to really pay attention to what the definitions are. And when it comes to identifying and reporting the statistics and things like that, these definitions will come in handy. Okay, so in closing, we would like to assure everyone that the COVID-19 response team and the health team is working diligently to protect our community. We are aware of the precautionary measures, all of which we are implementing within the organization and community. We're also aware that of the processes to use when we have a confirmed case of COVID-19. These are followed in a similar way to other communicable diseases, in that all information is kept confidential to protect the privacy of the individual affected. At the same time, because we are dealing with a large-scale issue with COVID-19, which has the potential for devastating impacts, and it is spread more easily than other viruses, it is important for us to keep the community informed about local cases. If you have any questions or concerns, please contact myself or Marina, and we can provide some responses to you. And if you have any questions for the health team, we can please send those, and we can take a look at our health Q&A for next week and responding to those questions. So miigwech, we hope you enjoy the remainder of the week. Enjoy the nice rainy day. It's feeding all of our plants and all of our trees. Okay, so miigwech, kwamapi.